vaccine. Now, I'm going to go through the vaccines in general, and this may answer some of the questions. Now, the immune system, it's three types now. It used to be natural and then adaptive. Adaptive means vaccination. It's a new concept called trained immunity, which is why now people use BCG vaccine, or even those who are immune or partially immune to COVID because of measles vaccination. So this is a new concept which need to be rigorously tested. Now, if you go to the antibodies, everybody knows that IgG, IgM, and IgA. IgA is very important for the respiratory system and the gut. Now, the whole aim of the immune system is to create B and T lymphocyte, effector and memory cells. And in addition to the phagocyte, whether they are polymorphs or macrophages. Macrophages actually the main phagocyte in terms of the viral infection. Next slide, please. Next, please.
Okay.
Now, we have natural immune system, but this is not sufficient, and maybe one of the factors to ameliorate the immunity to COVID-19, which is the immunity to the four main types of coronavirus that can cause common cold. Okay. The adaptive immunity, so far, unfortunately, SARS-1, the last case disappeared in May 2005, and we didn't hear anything about it. And that was started in China and moved with mainly in the Chinese people in Canada. MERS-CoV is the one Middle East, and mainly Middle East, Saudi Arabia, and SARS-2, which is COVID-19. It is very important to say that these are not proven zoonotic disease yet. So the host still remain to be found. Next, please. Why do we need the vaccine? Herd immunity, yes. Ameliorate clinical symptoms, yes. Prevent, reduce cross-infection, getting R below 1, which means that it's protecting other people. So it's a public health requirement. The clinical picture is mainly due to overreacting immune system. And the therapy actually tell us that we need to dampen the immune system. And as you know, the virus initially evade the immune system and then increase in number for some unknown reason and then attack the body. Hence, you get cytokine storm. And this is very interesting in this virus. And it is fair to say that those who are severely infected, they have high antibody against S proteins, which is something that we need to consider when it comes to the vaccination. Next, please. Now, the aim of all the vaccine which is mentioned, and you can summarize them, which I may go again to just give a summary, is to attack the spike protein. The spike protein S1 and S2, they are important to join the cells, mainly in the lung, but they are distributed in the body. S1 is for attachment, and S2 is for fusion of the virus into the cell. Then it can go inside the cell and then produce its own copies. IgG, IgM, and IgA, all anti-spike antibodies have been found and IgA, as I said, they are mainly in the respiratory system. Now, these antibodies are very interesting. Some of them are neutralizing and some of them opsonizing. Neutralization means that the virus is coated with the antibody and made redundant and then phagocytosed. While the opsonization side, which is a bit worrying when it comes to the one of the side effects or possible side effect of vaccination, is that when the virus attached to the antibody and through the FC receptors, taking it inside the macrophage and use it as a safe haven and then multiply. So that is very well documented as a risk of vaccination. In fact, a phenomenon has been very well demonstrated in dengue fever. Now, the aim of the vaccine, again, is to stimulate memory T cells. And the T cells are T helper cells and stimulate B cells. B cells, some change to plasma cell to produce antibodies, as you know, and some change to memory cells. And T8, which is cytotoxic cells, which attack the viral presenting, the antigen viral present cell, which mainly the macrophage, when they engulf the virus, then they show the antigen on the surface attracting the T8 or cytotoxic cell to attack. So we got two important mechanisms that are required by any vaccine to produce them. And in fact, almost all the vaccines actually are capable, at least in vitro, as well in the human being. It had been tested and they found they are capable of producing these type of immune reaction, antibodies and cells. Next, please. Now, how is the vaccine made? So far, there is no live attenuated vaccine for COVID-19 because there is a risk of that the live attenuated vaccine actually regenerate and then revert to a virulent vaccine. So far, nobody actually advocating live attenuated vaccine. However, there are dead viruses, or the main one is gene recombinant, which means that they cut the gene that produces the spike protein, inserted in the nucleus or in the gene product. Actually, the virus hasn't got a nucleus in the genomic structure of a virus like adenovirus, human or chimpanzee, or an animal virus like the vesicular stomatitis virus. And these viruses used as a vehicle to produce the spike protein to stimulate the immune system without doing any harm. Now, other vaccine like protein combination